Welcome back to all my colleagues and our sister company KPI, and welcome back to the new norm, unfortunately, as we battle the COVID-19 crisis together. As you return back to the offices in stage three, I hope that you and your loved ones are safe and well. In this current situation, and of course, as always, your health and safety is our top priority. Therefore, it is vital that you adhere to the new policies and procedures that have been made to ensure they protect you, your loved ones, and your colleagues around you. Today, as you can see in the agenda on the screen, we will take you through all the HSC support services and HR procedures, policies, and regulations that have been made to ensure your safety during this COVID-19 pandemic we are dealing with, which you are kindly again requested to adhere to as you return back to the offices in your Salhiya complex. Please note that all these departments have been working hard in the back burner just to ensure that you are safe and secure as you return. So before we start our session today, I'd like to take you through the safety moment, highlighting the e-brochure, which will provide you with the necessary tools in managing and preventing all the potential risks associated with the spread of the COVID-19 virus as you return back to the offices. Please give us a few moments of your time and pay attention
Safe return to the workplace during COVID-19 pandemic. Symptoms: fever, cold chills, cough and sneeze, headache. Help prevent the spread with these simple steps. Hand hygiene. Wash your hands frequently for at least 20 seconds with soap and running water, making sure that you wash in between fingers thoroughly. Physical distancing. To prevent the spread of COVID-19 transmission from person to person, keep a distance of 2 meters, 6 feet between yourself and others. Be smart. Stay safe. Stay healthy. How to wear a mask. Make sure your mask covers your nose and mouth completely. Help to limit the spread of COVID-19. Wear your mask at all times in the workplace and public places. After removing your mask, discard it in a closed bin. Avoid contact. Avoid touching your eyes, nose and mouth when you're not sure if your hands are clean. Cough or sneeze into your elbow. To prevent the spread of virus droplets, cough on your elbow or sneeze in a tissue. Stop COVID-19. Agility in adversity.
Well, hopefully you gain some insights and you will take them to heart, not only at work, but also as you live your life during this pandemic. Now, just a few things to point out. Everyone assumes that wearing a mask will keep you safe and protected. However, if your mask is not sealed, it's as if you're not wearing a mask. So kindly ensure that you have a sealed mask on you. What does a sealed mask look like? If you wear glasses and it fogs, know that the seal is broken. The way that you're supposed to wear your mask is actually to flatten out the top, massage it on your nose, and ensure that there's a seal. If you feel any air coming out from the sides, your mask is also not sealed. So for your safety, safety of your colleagues around you, please ensure to have a sealed mask as well. The other thing is, a lot of you might be asking, why didn't we mention gloves? Well, the WHO organization has actually stated that us humans, our psyche, think that if we have gloves on, we're protected because we tend to not sanitize as much, not use the alcohol sanitization. And in the end, touching our face, touching other parts, that the object, and assuming, well, our hands are protected, we've got gloves on. So that is why we prefer that everyone disinfects continuously, ensures their hands are safe and clean, and there is no reason for the gloves, assuming that you actually take care of your hands using sanitization gel that is actually 70% alcohol. The antibacterial ones will not work. This is a virus, not a bacteria, so please make sure you're using ones with alcohol. Now, on a more positive note, you'll have a nice surprise waiting for you in your offices once you return back, and that's the HSSE Protective Personal Kit. This kit will help you to keep safe and minimize the spread of the COVID-19 virus. It includes items like we said, the reusable protective masks, mask holder clips, because a lot of people after hours of sitting in the office will have a problem with their ears hurting from the masks. So these clips will help alleviate that pain and you will no longer need to put it on your ears. The other thing you'll find is safety key holder clip. That will be a tool that you can use to press buttons in the elevator, to open doors. Again, minimizing your exposure and your fingers and your hands to surfaces. And many other things such as disinfecting wipes and hand sanitizer gel. Now, please note, I'm sure you have a lot of questions that you would like to have answered. So submit your questions via chat throughout the session, and we will be answering as many as we can by the end of the program. Please ensure to state if the question is addressed to the VP, the HSE division, HR, or support services when you submit it. And now, without further ado, let's start with our program, and we will start with a welcome note from KPI's VP of Planning and Finance, Mr. Walid bin Ali. Khalid, you can go ahead and start now.
Thank you, Shaima. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good morning, everyone. On behalf of KPI management, I would like to welcome you all back to office, inshallah, after Eid. We've been away now for almost 5 months, working from home or working remotely, as they say, going through the crisis together, and hopefully everyone is safe and the family and friends. And I would like to thank all the departments who worked to make the office much safe environment, quality assurance, support service, and HR. They worked together for a long period to make the office safe and place that you can work safely, hopefully, inshallah. And please adhere to all the safety precautions, requirements. This is for your health and the health of your colleagues and your family. We would like to wish you safe and good health, inshallah. And if there is anything, we are there to support you. And we'll come back again. Take care and bye-bye. Back to you.
Thank you, Khalid. And now we'll move on to the first part of our awareness session, which is the HSE part. And we will have Mr. Fuad Qabazad, Manager of Quality Assurance KPI, give us a few words. And then Mr. Mohammed Lebloushi will follow it with a presentation prepared in the sense of the HSE regulations and a follow-up video as well. Mr. Fuad, you can kindly start.
Bismillah ar-Rahman ar-Rahim. Thank you, Shaima. Good morning, everybody. I will start my speech with the KPI President and CEO quote during KPI Town Hall that was held back on July 1st, 2020. Challenges ahead are numerous and difficult, but working together, we can summit. At KPI, we are committed, putting our people first. Your health and safety is our #1 priority. As you are aware by now that COVID-19 is officially listed as a pandemic by the World Health Organization, and with so much yet to understand. Having said that, we wanted to have this awareness event to let you know that the extraordinary and proactive steps KPI has taken to ensure your safety, as stated by EVP Khalid, Planning and Finance. Through this, KPI, HSE, Human Resources, and Support Services Department have worked together side by side and have implemented a number of guidelines and risk controls. These risk controls will help KPI in head office reduce your exposure and the transmission of the COVID-19 virus. And above all, ensure your safety and the safety of others around you. And now, I'll leave the floor to Mr. Mohammed Abloushi from Quality Assurance HSE, who will take you through a presentation. The presentation will highlight the HSE precautionary measures that you are kindly asked to adhere to. Thank you very much.
Hello, good morning, everybody. I'll take you to a safe return to workplace presentation. And I have three main agenda items. The first one is our preparations to return to the workplace. And number two, COVID-19 emergency team. And three, what is required from you. Yes, we have completed the COVID-19 e-brochure. This mainly covers the main guidelines to protect yourself and others from COVID-19 when returning back to the office. And also we have completed the social distancing ground marking designs. These actually have been developed for the sake of keeping a physical distance of 2 meters among all employees. And here in this slide, I have some pictures of the social distancing marks and signs. And this is how the head office looks like during the pandemic. On the 24th of June, 2020, and in cooperation with the Ahmedi Hospital, 4 KPI employees completed the COVID-19 Pandemic Recovery Crisis Management Plan training course. Also here, I would like to mention and thank these employees, Mohammed Al-Baddah, Omar Al-Ghanim, and Ziad Al-Nafisi. And from that part, we started our part to train the trainer. We trained the security staff on how to wear the proper PPEs of the COVID-19 and how to control the employees' temperature. And also, they were trained to isolate any suspected COVID-19 case. Also, our cleaning and pantry supervisor, Mr. Saeed, he was trained and he trained the cleaning and pantry staff on the COVID-19 protective measures. Here we have the COVID-19 emergency team established, including the 3 representatives from Quality Assurance, Human Resources, and Support Services. Here I can say that all expected scenarios have been reviewed and all necessary mitigations and controls are now in place. Our key message here, stay safe and report if you have any COVID-19 symptoms. The symptoms mainly are fever, cough, and shortness of breath. And now what is required from you? You are kindly required to complete the coronavirus e-learning awareness course, which was received by email from iHasco e-learning. And also you're kindly required to complete the COVID-19 questionnaire. Actually, this is a way to collect data and information from our contractors, employees, prior returning to the office to analyze and eliminate any expected risks. And now I'll take you through the e-brochure. You'll find in the first page a message from the president. As he presents this e-brochure to you. And also you'll find the main precautions to protect yourself and others against COVID-19. And now we would like to bring to your attention what should be done in case a suspected COVID-19 case at work. And here is a video to demonstrate that. Okay.
When feeling a fever or difficulty breathing, immediately isolate yourself in your office, inform your line manager and HSSE representative. Go to the nearest medical center. If you cannot drive, call emergency number 112. If someone at work shows symptoms of fever, cough, shortness of breath, isolate the person from others at his/her office. Keep a social distance of 2 meters from the suspected or confirmed case. Inform. Call the Ministry of Health COVID-19 hotline 151. Follow the advice of the health officials. Transport. Ensure that the person is transported to their home or to a medical facility. Clean the area where the person was working and all places they have been. This means evacuating those areas. Use PPE when cleaning. Identify who at the workplace had contact with the infected persons in the last 24 hours before that infected person started showing symptoms. Send those people home to isolate. Allow employees to raise concerns. Clean the area where the close contact persons were working and all common areas they have been. This may mean evacuating those areas. Use PPE when cleaning. Review risk management controls relating to COVID-19 and review whether work may need to change. Keep employees up to date on what is happening.
Thank you, Fuad and Mohammed. And just for everyone to know that the e-brochure will actually be sent out today. So kindly keep it for your references, whether it's in your personal life or at work. Hopefully it'll give you some confidence and tools to be able to follow. Now let's move to the second part of our awareness session, which is the support services regulations part. And Mr. Hassan Hamadi, who is the manager of the support services in KPI, will take us through actually a guided video of the Salhiya complex and also a few slides highlighting some of the work that support services done. Hopefully, this guided video will reassure you and the element of the unknown will be removed. Because I know it's been quite some time since you've been back. I'm sure everyone's wondering what it's going to be like when I walk into these doors. So Mr. Hassan, please go ahead and take us through the video. Thanks.
Throughout all of that, I think the team's perseverance, strength, and I would say agility through this adversity really has held up very well together.
Thank you everybody. I hope that you are keeping well and healthy. Now I'm going to take you through the how are you going to expect your return to the office. First of all, I'll start with the entrance of the Salhiya. So just to let you know that the parking lots are still open. The 3 parking lots, which is either you are parking inside Salhiya or the Salhiya opposite to Salhiya building, or in Al Muttahida, it's all open, so you can park normally. And then when you come in, as you saw in the video, there will be Salhiya require you to wear a mask. So please make sure that you come in with a mask. They will take your temperature, and it's they will control it, make sure that it's not over 37.5. And I have received also some questions that, if we are going through this, the heat and the sun of Kuwait, maybe our body, reflect the heat of the weather. But this is also, I mean, Salhiya is aware of this. So if your temperature is slightly above, so they will ask you to wait for a minute, and then they will take the temperature again. So you don't need to worry about that, and hopefully you will get through. So once you get through the Salhiya entrance, whether from inside Salhiya downstairs from the parking or the main entrance, they will take your temperature. And then once you are in the elevator, there are markings that shows that you can only have 2 people in the elevator. So only 2 are allowed to go into the elevator. And now it's really important also to make sure that if you're working on the 3rd and 5th floor, please use the gate 5. If you're working on the 4th floor, please use gate 4. Not all the gates are open. This is as per HSE directions and as per the health and safety regulations for COVID-19. We would like to control entrance to the office and make sure that anybody gets into the office is, his temperature is controlled. So again, gate 5 for floors 3 and 5, and gate 6 for floor number 4. Now, once you get into the gate, you use your card, please. Do not use your fingerprint. Use the card to get into the to the office. Once you get into the office, the security person will train to take your temperature again, and then you will be into your office. Now, as Mohammed Bouchi mentioned, there will be markings in the Salhiya office and the floor on the meeting rooms. It will show you the capacity, the maximum number of people who's going to be there. So everything should be clear. If you have any question when you're there, clarification of anything, of course you can call 855, the help desk, and we will help you going through this. Now, to put your mind at ease, we have really worked hard to make sure that when you come back to the office, it's clean and hygiene. So we have done a deep sanitization for the entire office. We have hired a professional certified company to do that, and also we have done a deep cleaning for the office and duct cleaning. So we have cleaned the ducts and all the offices, and also we have sanitized the entire office. If we go to the next slide, please. Yes. Okay. So that was mainly from general services point of view. From the IT point of view, we still support you. We still support people that will be working from home. As you know, it'll be 2 teams, blue and yellow. So we will support the people who are working from home and from the office at the same time. Now, we encourage you to, if you have any meetings, you use the virtual meetings. We have 3 ways of communication in the office. As you may all know, we have Blue Jeans and Teams, so you can use those programs to conduct virtual meetings. And also we have the Mitel. The Mitel, I mean by the Mitel is the desk phone or the phone that you find on your desk. You can use it for video meetings as well. But if you if it's deemed necessary, that you are going to have a physical contact, the markings on the meeting rooms are marked with the total number of capacity for each meeting room. Having said that, I wish you all the best coming back to the office. We miss you. We miss serving you in the office, and wish you a very good health and safe return.
Thank you, Mr. Hassan, for that. And now that we'll move to our final part of the awareness session, before we move on, I'd like to just remind everyone, please go ahead and submit your questions if you have any. I know that the team has done a great job in making things very clear, but I'm sure you do have questions. So we're waiting for your questions and we'll address them towards the end. Now, without further ado, we'll move to our final presentation and part of this session, which is the HR regulations, and Mr. Mishal Al-Melis, Manager of HR, will take us through it. Kindly, Mr. Mishal, go ahead.
Thank you, Shayma. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Actually, thank you for joining us today. It's a great opportunity to communicate with all valuable colleagues through a virtual session. I will take you through the HR session and where we can benefit the employees with many information, and also later on we'll take some questions. As you may know that the maximum capacity for stage 3 is up to 50% of workforce, and we will stick with this percent. Inshallah, the return to office will be after the Eid, on Tuesday, 4th of August, from Salhiya complex. We have worked very hard with all the managers to divide the departments to 2 teams. And we have successfully identified the blue and yellow team, and all the direct managers have now the lists, and they will communicate with the staff. We will ensure the 50% of the capacity, and we will implement the 1-week rotation between the 2 teams. The working hours, as you know, we will stick with the previous working hours from 7 to 3 with flexi half an hour. And we will continue as normal as before, inshallah. Next, please. As we mentioned, the 2 teams is based in the manager and direct manager's selection of his colleagues. And also we ensure that all the staff in the same day will not exceed the 50% of the workforce. There is a team goal, and this team will be identified after the online precautionary checklists. And I would like to encourage everyone, is it a must to fulfill these requirements, to go and to fill that precaution checklist, because that one will give us a room to identify and filter the people that need some help and that are not meeting the fitness conditions. As you know also, the precautionary checklists will be handled securely, and nobody will be tested unless the local insurance departments along with the quality insurance departments. So the action items now for the return back to office, HR will provide all managers with the lists, and already we have submitted that. The blue teams will start first, inshallah, on Tuesday, 4th August. And the yellow team will start in the following week, which will be in Sunday, 9 August 2020. Thank you very much, and safe return, inshallah.
Thank you, Mr. Michel. And that in turn actually sums up and wraps up our day. We actually were supposed to take your questions and answers. And let's see what we have here. Okay, good. So we do have a question for, this seems to be for HSE. And so Mr. Fuad, question, in case of getting infected, how many days I have to be in quarantine and what report is required? So maybe that is for HR and HSC as well. For the reporting might be HR, and Mr. Fuad, if you can enlighten us also on the quarantine time.
Thank you, Shaima. Again, as been stated before, that we will follow the Ministry of Health, and if I'm not mistaken, it's 14 days that who is being diagnosed as a positive will be quarantined at home for 14 days. After which, definitely the health, either the hospital, they will release what you call a statement for the employee, for God, that he is cleared from the positive of the which is tested negative. Just having said that, we have just to let you know, guys, that we have already 4 cases in KPI. 3 cases were employees as well. There was 1 contractors, and they have got the being diagnosed positive due to their loved ones, which they got them from their work, and now they are clearly have submitted that they are now negative. And this is just to throw your attention, but they were compliance with the health minister's requirement terms, quarantine 14 days. I don't know, Abu Khalid, anything from your end? I leave the floor to you.
Well, if I understand the question correctly, maybe our valuable colleagues, they are asking about if they having a holiday and going back and coming back again to Kuwait, they will be subject to quarantine of 14 days, and this will be subject to be from their holiday entitlements, or gonna be from the government's procedure as a sick leave. Actually, this question is still under process with KBC and K companies to find out. We were in discussion yesterday with the HR managers in K companies to ensure that we have to have a clear answer whether if somebody have any holiday to go abroad and coming back, what's the 14 days quarantine should be subject to. And once we have the answer, we will inshallah circulate it to all people.
Mr. Hassan, also, if someone, Allah la yaqulha, got infected, another thing they're asking is, what kind of reporting is required? Shino reportedly they can submit, or that it needs to be submitted in case that happens?
Okay.
Maybe
well,
that actually goes to Mr. Hassan, actually.
Okay, we have, as Abu Rida just mentioned, that we have a checklist of questionnaire. This has to be submitted once anybody is feeling that his condition has changed. Now, let me just establish the thing again that, okay, nobody's allowed to get into the building unless this checklist is filled out online and then goes to HSC and then goes to HR, and then HR will tell us that this person is allowed to enter. Now, this has been done, I think, for most of employees, but whoever did not do it, please do it, because if your name is not on the list, unfortunately, we will not be able to let you in. Having said that, now, if you have submitted this checklist once and your condition has changed, you have to submit it again, and then HSC will evaluate this and then contact HR, and accordingly you will be informed what to do. But if the symptoms have, I mean, if you find the symptoms while working or while you're at work, please report this to HSC that you have, you are feeling, shortness of breath or coughing or anything of the systems that, we just mentioned, and they will guide you exactly what to do. I hope this answers the question.
Thank you, Mr. Hassan. Actually, another question coming your way. Another question says, is there a waiting area in Salhiya in case there's overheating? يعني sometimes, you know, إحنا because of Kuwait and the weather we have, الناس dish and they have temperature that is above the norm. So is there a waiting area? What's the procedure there? Protocols?
Well, and if you're coming through the Salhiya parking downstairs, I mean the for the allowed parking, for the people who are eligible for parking, you will get measured from the entrance, from the security person. And if your temperature is more, he will not be able to let you in with your car. Okay, so but if you're coming from the main entrance, there is a waiting area. Like I said before, there is a waiting area. We have coordinated this with Salhiya, and they are taking this practice regardless for us or for anybody else. To be honest, yani. So everybody knows that, you know, the heat of you know, Kuwait heat and the sun and everything, that maybe the body gets, you know, overheated from the weather. I mean, not from internal temperature. So they will ask you to wait for a minute, just aside, just to take your breath, and you know, maybe your temperature will cool down. You will cool down, and then they will allow you in. But from the gate, only for the people who are coming into by their cars, you know, through the gate. I think, you know, most likely it will, you know, they will have their air condition and the cars are running, so they will not have any problem. But there is no waiting area for cars. Only the people who are coming through the entrance.
Thank you so much. Mr. Mishal, we have actually 3 HR questions that came in your way. So let's start with the first one. Taking into consideration the long queue on Salhiya elevators, will you consider increasing the flexi time?
Well, actually, during this exceptional time, we will be very flexible with everybody, and we have communicated this with all the managers. Flexibility is there, trust is there. The employees have to communicate directly with their direct managers if there is any problems or any symptoms arising. We encourage the people to be open to discuss with their direct manager, with HSE. We will all be helpful to everyone. So flexibility is there. Just we want everybody to be safe. We want everybody to be comfortable when they come into to work. And I assure you that everybody will be helpful, whether the HSE, the support services, HR, or their direct managers. Second question is theirs.
Yeah, I'm sure everyone was very happy to hear your answer there.
Okay.
Second question for you. If one of the team got sick, like normal fever, but not the flu, not the COVID, do you still need a report that says or that they have to stay there for 14 days? I'm assuming what they mean is if they have not been tested negative or positive for COVID, how would you address that? And you know, if they had been tested and they're negative for COVID, بس عندهم the flu مرشحين, what do they do?
Well, maybe all of us will be in machine. Just actually, we have very clear rules and regulations in KPI, and they will follow the previous rules and previous procedures. If they are sick, or if they feel they are not, they have some symptoms arising, they will follow the procedure. They will follow the procedure to go to the local clinic to get their, you know, medical and prescription. Just when they get any symptoms or any fever or such cause like that, they have just to follow the normal procedure to excuse from their direct manager and to go to the local clinic, and from there the local clinics will give them the prescription and the report whether they have to stay at home or to come back. Back to you, Shayma.
Okay, please don't kill the messenger, Abu Khalid. لأن شكله another 3 questions coming to HR.
Okay.
First one is there a new policy on annual leaves? هاي واحدة.
Okay, the annual leave. We all know that there is, we didn't take annual leave for this year, and will be accumulated leaves, which we are now discussing with the K companies to carry over them and to give them extension to the following year. So in the past, we are not allowing people to keep more than 90 days in their annual entitlements. This year, because it's very exceptional, so we'll allow people to keep their leaves to the next year. And as normal, they can apply for leaves anytime. We didn't stop working, even for the previous duration. We were also allowing people to go in annual leave.
Okay, thank you. Now, the other question is, other K companies, I think you've already addressed this, is saying they're forcing them to take their annual leaves. So will this be applicable to KPI? Are you going to force people to take their annual leaves ولا بتروح عليهم?
As I mentioned earlier, the employee will have the right to carry over their leaves up to next year. So they will have plenty time so they can plan their leave as normal. And they have to discuss it with their direct manager, and we will ensure nobody will lose or forfeit any leave entitlements.
Perfect. And I think the several other questions came your way. Alhamdulillah, you already answered through your answers. So I think now رح نرحمك شوي. We'll move to a question in regards to, let's see here. This is, I think, for Hassan. Are we going to use all the gates of Salhiyah to reach our offices? I think you mentioned that, but maybe you can highlight that again.
Yes, well, because we need, let me just say the rationale behind it first. Because we need to control temperature for people who are coming in, we need to make sure that in each gate that people can come into the office, there is a security person that can take the measurement of the temperature. So we have assigned, in coordination with HSC or quality assurance, we have assigned gate 5 for floors 3 and 5. So 3 and 5 is for floor 3 and floor 5, gate 5, and gate 6 for floor 4. And this also, was carefully chosen because of the earlier question that there will be, a long queue on the elevator. That's why we're trying to distribute the load. As you know, the fourth floor has the, high population in our office. Fifth and third almost the same as the fourth. So that's why we use different gates. So gate 5, again, gate 5 for third and fifth floor, and gate 6 for the fourth floor.
Thank you so much. Now, I'm sorry, Mr. Mishal, again, one last question for HR. Does our K sector medical insurance cover COVID-19 testing? ما عندنا حد من insurance, فhopefully تفيدنا with this information.
Well, they are covered by the government as a whole, not just by the medical insurance. So if there is any symptoms for COVID-19, they have to follow the government procedure to go to Mustashfa Jaber Hospital, and to follow the procedure, because the private clinic, they will not accept anybody with COVID-19 to be treated in the private sector. So I believe the government and the history of health Ministry of Health will take care of this.
Great, thank you so much. And it seems our final question of the day, I'll let you choose who would like to answer. We have, if traveling abroad on holidays. What's the procedure when coming back? I think you've addressed the fact of the quarantine for 14 days. Secondly, would the company allow to work remotely during the quarantine time in Kuwait?
Actually, working from home, even during the quarantine, if the employee be able to work from home during the quarantine and there is no severe symptoms, and and they are not in the high medical conditions, and they be able to work and support his team. At the end of the day, we believe that everybody is contributing to his department and to his colleagues, and we believe that everybody would like to also help each other. So it depends of the condition of the employees. If he can be able to help and support his departments and his colleagues, he should do. If not, he will be in quarantine and he will be in medical case.
Great. Thank you so much. I think this wraps up our questions and our session for the day. Anyone from HSC Support Services or HR would like to say any last comments before we close this program? Okay, so if anyone has more questions that they have not submitted or didn't have time to submit them, kindly send them across to us and we will ensure to answer any concerns that you have. Now, we're reaching the end of our session and I just want to thank everyone for attending this awareness session. Wishing you all a safe return back to the new norm in your offices, in the Salahiyya complex, and in advance, Eidkum Mubarak. Try to enjoy your holidays safely and stay safe. God bless everybody. يعطيكم ألف عافية.